Hello and welcome. My name is Kathy Zimmer, and I'm the Executive Director of Telehealth and e-health services here for the Altman Health Foundation. And today, our agenda, Mike, can you move the slide forward? Is going to be about technology, what Altman is using for technology, and how possibly you can use some other technology to track your health. Um, we're going to go over what we have here at Altman today, and then we will be sharing some other items with you that maybe will be helpful for you. So just to review, we have implemented an application called Altman Now, and this is a app that you can download on your phone, or you can go to the website. These are the practices we have available when you come to the landing page. We have 26 Altman provider groups that are up with our application for telehealth online visits. And we have there's specialty, primary care, internal medicine, there's therapy, there's some lactation services and weight management, diabetes, nutrition, and some other services. So the next slide just goes over the types of communication that we use for taking care of our patients. So as you know, COVID has really changed the landscape for healthcare. Um, in the past, you're used to going into the doctor's office and doing an in-person visit. Now, COVID, we're trying to keep people safe and keep them in their homes. So we're able to do online visits with our patients, so we can still take care of your medical needs, but we use technology as a communication tool along with a phone to help you with your treatment, diagnosis, getting medications. So here's a screen just about the patient can use their computer or their mobile phone. We do have a telemedicine cart, which is in our post-acute, our Woodlawn facility, that we can actually have consultations with a cardiologist or an oncologist while they're at the nursing home or their post-acute setting. And they can still be seen by that specialist versus the specialist going to the facility. We also have this available in our ER for telestroke off hours. Um, and it's just a way of communicating between the patient, the family member, the nurse, and the provider. So the next slide talks about how telehealth has grown over the past several years. So we started this service in 2018, and we focused just on our urgent care to provide urgent care needs. And then we started to grow in 2019 with adding the specialties and an office or two. And then COVID hit, and then now we have the 400 providers on and staff nurses. So you can see we've done 22,000 visits this past year in 2020 with COVID. So you can see telehealth has actually exploded for us here at Altman. As you can see here, visits were only for the whole year, 780 and 19, and the whole year now, last year was 22,000. Now we're starting off with a trend where we're letting patients come in the office, but for those patients who we can see by telehealth and they don't need to be seen in person, we are doing online visits with our providers and the offices. The next slide shows you the type of online visits we're doing. So this is our Altman Now application. We actually have partnered with American Well. That is the vendor that's behind Altman Now. And we do scheduled office visits, which you receive a provider link. You can get it by email or you can get it by your text message, and you can use your laptop, your iPad, or your smartphone. As long as you have a camera, a microphone, an email address, or a cell phone number, you can use our platform. So this is a new feature. When COVID was going on, um, you had to download the app to get to the app. Well, our company that we work with um, understood that there were some patients that couldn't download the app and have issues. So they worked with us, and we now have a URL text link that we just put to your cell phone, and you click on the link at the time of the visit. It's a secure, HIPAA compliant text link that you just click on and you do the online visit. So you may call your office and they'll tell you the appointment time, and then they send you a link at that appointment time and you just click on the link for the office visit. This is exactly what it kind of looks like. Now, it does not say AMWell, it says American Well, but it walks you through the steps. There's the visit, the link, you would click on the blue, and then it asks you for your name. That's how you know you're getting it and who it's from. And then you join the visit, and then the provider shows up on the screen and you're up on the corner and you just have your visit that way. It's very simple. As long as you have the correct technology, which Mike will show the next slide. You need to have an iPhone with the operating system of 13.6 or higher. You must use either Safari if you're using an iPhone or Google Chrome. You need to be connected to your Wi-Fi connection. Android, you need to be at the latest version, which is version 9, and you must use your internet browsers of Google Chrome or the Samsung browsers. Again, as long as you have this technology and you keep your phones with the latest software, you should be able to do a visit. So as you know now, we talked about you can go to the computer and you can do an online visit using altmannow.com, and it takes you to the landing page, or you can download the app from the App Store and create an account, and you can do it through your cell phone. So there's two different ways to use our online video visits for our providers. And then the other one is the URL text message that we talked about, or an email, and that comes that way. The next slide. What can you do with this new service? It's fast, it's easy, it's convenient. You don't have to leave your home. We have availability for our urgent care. It is covered by our Altman urgent care providers, or our American Well providers. A visit on our urgent care, the time usually is about a 9-minute visit, and the average wait time, depending on how busy the providers are, is about 7 minutes. If you're using our providers, you will see an Altman logo for our providers when they're on, and then our American Well providers, they don't have the logo, and you'll be able to see them. So that's how you use our urgent care. And you would use this urgent care if you can't get into your doctor's office. You can go for allergies, bronchitis, you can go for COVID symptoms, and they'll see you, make a diagnosis and treatment. If you would need a medication, they would just electronically send that to your pharmacy, and you would just go pick it up, and you wouldn't have to leave the comfort of your home until you have to pick up maybe the prescription. But you can see here, they're non-emergent medical conditions. So something that they can talk to you about, ask you your history, a rash, flu. That's what you would be using this online urgent care for. Next slide. So again, just download our app. There's a QR code here, and you just go to Altman Now and you see a doctor. Okay. The next slide talks about exactly how to do it. So we just put some screenshots in here. You log into the Altman Now on your computer, and this is the landing screen. This is the app also, same landing screen. You have to have your email address and you have to create a password. Once you have a password, you have it every time you log into our app. So once you log in, you would go to select the practice. So I was talking about urgent care. You would select Visit Now, and then you would select the doctor. We have a test doctor here, but you would select them. If you'd like to see more about the provider, click on their name and on their face, and it'll show what their background is, their language. Um, these visits now are $59. You can add a guest to this um, invite so that your family could join the visit with you and listen. You need to just select if you also have a what do I want to say? If you have a family member that's under the age of 18, you can make them on your account and they can do the visit for them. You just select continue. You answer some basic information that the provider would like to know, and you can upload a picture. By just taking on your phone, you just take a picture and upload it there. You do need to note it, agree to the notice of privacy and consent for your visit, and then you select continue. And then here are just the screens for medical history. So if you're seeing a provider, they like to know if you have any allergies. Maybe if you have a blood pressure cuff, you can put your blood pressure in there. Otherwise, they can ask you, do you have high blood pressure? And you can share your health summary with the provider. You just need to select that button. Other than that, we'll go to the next screen. You will choose your pharmacy location, and this just tells you which pharmacy you would like if you're using our urgent care. This is where you could go. Just make sure you select the correct pharmacy. Look at the address when you do that, because I have had some people who have done it, but they've actually they just read CVS pharmacy and the basics. They didn't read the address. Maybe they picked Canton, but didn't read the address. So please just make sure you have the right pharmacy when you're selecting that, because that's what the providers are going to use when they select your medication, if you would need an electronic medication filled. For cost, you would just put your credit card number or your HSA number, debit card. It is $59 now, not $49. There was an increase this past year due to our vendors and our insurance. So this is actually cost you just for our urgent care $59 for a visit. But other than that, you would just then a video comes on, and then you wait for them to arrive on the screen. And this is pretty much what the screen looks like. You have the provider, yourself, and if you had a guest or a family member, they would show up on the screen and you would talk to them and have a visit. Once you're done, you end the visit and you select end. And then you will be given a rating screen on how your experience was. And then you select done. When you're all done, it does ask you for a summary. So if you are using our not Altman providers, they actually send you a summary. The American Well providers that are covering us, they send you a summary right to your email. If you're using our Altman providers, it goes to your Altman portal, and you can get that information that way. The only thing you need to do is select the questions there. If you wouldn't have used Altman Now, where would you have gone? And then you select done. And then it just takes you back to the login screen, and you'll just go down to the 3 dots at the corner and log out. I was talking about access. So say you forgot or you lost the email and you wanted to share it with your provider, the information, you can go and access the information if you did see a American Well provider versus an Altman provider. And this is how you do it. You just log into your Altman Now account, go to your records, and it would show when you had the visit. But if they are documenting, it's your own provider, they're actually documenting in their electronic medical records. So then they would send it to their portals and send it that way for you, which is HIPAA compliant and secure. This is the portal I was talking about. So we do have an Altman portal here at Altman. So either you're in the hospital or you see one of our Altman providers, you would just access by having an email account and setting up a password, and then you would be able to see your record if you had any lab work or anything like that. The next slide shows you our concept. If you're seeing anybody in our Altman facilities, that's Altman Orville, that's Altman Alliance, the main hospital, any of our facilities, and any of our Altman providers. We have something called One Chart, and that allows you to get your information anywhere at any time, um, access to your record. And then the next slide shows you the benefits. You don't lose your records if they're paper. You can get um, online bill service. You can get access to alt care through this portal, and you can get your medical records and your lab work. The next slide just talks about how it looks, just on the right side, how it kind of looks. You'd have your profile, your lab results, your documents, and you would select them and you can see all of them. So if you have had any lab work done at Altman, it goes there. And it also goes to your physician portals too, that they've given you in their offices. So that is it for our Altman Now platform and our technology platform that we're using. I think you're going to see a hybrid use of this. So you'll see some visits that are done in the office, and then there's visits that are done in person. I think it's just depending on what kind of um, what's going on with you medically. If it's just a lab result or a follow-up, and you don't have the time to drive to the office or you have transportation issues, ask the office, say, hey, can I do a telehealth visit? Because they have the ability to do it. You just need to ask. You as the patient definitely can ask those questions because it is available. And then each office can send you their instructions and how they do it. So Mike, I'm going to hand off to Mike Logozzo. He is our Altman Now technical specialist, and he's going to tell you a little bit about how you use your smartphone for your health. Um, um, and he'll give you some details on that. And I'll answer any questions at the end about our Altman Now app or any questions that you have. So I'll hand it over to Mike.
Thanks, Kathy. Yeah, my name is Mike Logozzo. I am the eHealth technical analyst. I've been with Altman for about 8 years and 2 years with Kathy and the telehealth team. So I've learned a lot. There's a lot to go over, but it's been a fun time. So I'm going to go over how you can use your smartphone or your tablet to track your health and just improve your overall health. This slide shows the top apps for health and fitness for the Apple iPhone. I can go over like the top 3 for each. Now the free apps, as you can see, there's the #1 app for health and fitness on the iPhone is the iVibrate Calm app. It turns your phone into a massager, so it has different speeds, different variations that your phone will vibrate with, and you can place it on your back or your leg or your thigh, and it will just massage it. Pretty amazing. Planet Fitness and MyFitnessPal are the next 2 for just tracking your workouts and your diet and that sort of thing. The top paid apps for iPhone, there's the #1 app is actually, it's called 75 Hard. I've never heard of it, so I had to do some research on it, and it's actually, you can see right there, it's like a mental toughness app. Basically, you can track everything that goes on in your life, from tracking your workout routines, your diet, nutrition, your sleep schedules, alcohol intake. It's just an overall way to keep track of everything that you do in your life. The next popular one was called the Wonder Weeks. It's a pregnancy application. It does everything from, it has a due date calendar, a gender predictor, a fertility calculator. It's just a great way to keep track of everything throughout your pregnancy. And then the third highest top paid app for iPhone was a sleep tracking app. So those are becoming more and more popular. We can move on to the top Android apps, the free apps for Android. And a lot of these you'll notice from the iPhone too. A lot of them are the same apps. They're just ranked a little differently. Number one was Planet Fitness. Number two was a walk tracker. And number three was Fitbit, excuse me, Fitbit, which is similar to Planet Fitness in that it tracks your workout routines, the steps you've taken throughout the day, the miles you've ran, that sort of thing. And the top paid apps, pretty much the same as the iPhone, the 75 hard and the Wonder Weeks, which we talked about. And then there's a diet and calorie intake calculator as well. I'll get into the Apple Health application. This is, again, only for iPhone users. It's a health app that makes it easy to learn about your health and how you can more easily reach your health goals. There are third-party apps such as, I think you could use the Planet Fitness app, or even there's an app called Calm, which is like a meditation yoga type of application that you can manually keep track of those health habits. And this is accessible from the Apple iPhone 5 or newer, so it's been around for a little while. Different things that Apple Health tracks. It tracks your active energy and your resting energy, your heart rate, the steps you've taken throughout the day, your heart rate variability and your resting heart rate. It tracks a lot of different health data. If you actually have an iPhone with you right now, you can open it up. And if you see the little browse button in the bottom right corner, you can see all the different health categories that it tracks. Anything from your body measurements, so like your height, your weight, your body temperature. It has a hearing module on here. So if you are listening to music when you're working out, it'll actually tell you if your music is too loud and it's not healthy for you. Mindfulness is actually, I mentioned earlier about like the yoga and meditation apps. It integrates with those different apps if you have them downloaded, and it keeps track of the minutes that you spend in those apps. It's basically, it means living in the moment and not just observing your thoughts and feelings in those applications. It's a good way to keep track of those different minutes. More health data with the Apple Health app. The nutrition module in here is huge. I mean, it keeps track of just about everything you can think of, from caffeine intake, your calcium, copper, fiber, sugars, sodium intake, all the different vitamins, your water intake. It's a lot of different things you can keep track on here. And on the right-hand side of the screen, you'll see there's a sleep tracker as well. Those are becoming more and more popular. It just estimates your time in bed and your sleep by analyzing the changes in your physical activity and different movements you do during sleep. So the sleep trackers are becoming more popular for sure. The emergency contact and medical ID. This is a function with the Apple Health. I actually didn't know it until I opened up the application and started using it. It can come in handy big time, especially if you're in a medical situation and say there's a paramedic, if you're in an accident and a paramedic, they can just grab your phone and there is an emergency contact button on that phone. Once you set it up, it's always on there, and they can just press that button, and it lists your medical history, any emergency contacts you have, any allergies you would have to medication. If you're an organ donor, it's very useful. It could save your life. So very important thing to have. And now I'll get into the Android version of the health trackers, the Samsung Health, which is basically, it's very similar to Apple Health. You can actually use this on both the Android and Apple platforms. With Apple Health, it's only available on the Apple platform. Again, you track your fitness, your weight, your diet, your sleep. It does almost everything. Different things that the Samsung Health app tracks. Again, your active time, your resting time, the steps you've taken throughout the day. It tracks your runs. If you're a runner, you can track your weight, count your food, your heart rate. And then another thing that Samsung Health does is that there is a together tab function. And if you were to have the app, there's a together tab at the bottom. And what that does is it kind of challenges your friends and family to kind of exercise with you. So you can have competitions to basically just to make exercise a little more fun for you rather than just doing it by yourself all the time. It has like weekly goals and who's done the most throughout the week, who's taken the most steps, who's ran the most miles, and in what time did they run that. So Samsung really makes it fun and interactive with getting your friends and family involved with you. More on Samsung here. There is a discover button in the bottom of the app. It has different health articles you can read, different programs. If you're trying to lose weight or even stop smoking, it gives recommendations on different programs that are out there that can help you. It tells you different products that are out there for like different health watches and trackers, which we'll get into here very soon. And then any promotions, like any sales going on with Samsung, it'll make you aware of them. So now we'll get into the watches. Apple Watch. This is for Apple products. Great way to track your health and fitness. There's prices that vary depending on the model, anywhere from $149 up to $400. So they can get a little pricey, but they are a great accessory to have. Different features. This is why they're so expensive. They do everything. It can check your electrocardiogram, checks for irregular heart rhythms, it has a fall detection on it. There's a button on there to call emergency if you need to. There's just so many different things on this app. It's amazing. But it's not only it's not only a health tracker. You can answer phone calls from the watch. You can do text messaging, take photos, listen to music. There's a lot into this watch, excuse me. And the Samsung gear, basically there's a Samsung Health Watch, which is a lot like the Apple Watch, just for the Android side of things. It's not as pricier as the Apple products, but it does basically a lot of the same things. Samsung has a health tracker. It's similar to Fitbit. We'll get into Fitbit here in just a minute, whereas it's different from the watches in that it just tracks steps you've taken, miles you've ran, and the time it took you to walk and run whatever workout you want to have set up for yourself. So it doesn't have any of the other features like phone calls, texting, electrocardiogram. It's a tracker. And then here's the Fitbit. The Fitbit is its own company very similar to the Samsung watches. It tracks, again, it can track your steps, your heart rate, your sleep, there's different personal metrics, and you can see the different price ranges there. We'll stick with Fitbit. They're probably one of the most popular used application and products for people that are involved in keeping track of their runs and their walking. You can keep track of the distance you ran, your calories burned, your active minutes, and you can also track your sleep. Again, more on Fitbit. It's just a great activity tracker. Tracks all your runs, different exercise stats, and how it impacts your overall day. You can add workouts to your calendar, so it kind of reminds you if you're getting off track, you can create a schedule in your calendar to have your workouts done. And then this is, again, how you can get your friends involved. You can have challenges to compete with each other to make it fun. You can track your weight and nutrition. You can measure your hydration by measuring your water intake, your weight each day. You can log your food. Very intuitive. And then these are the different health gadgets that you can integrate with your phone. There's a gluten sensor, there's blood pressure cuffs, stethoscope, thermometers, otoscopes, different TENS units. These are all evolving, and it's only going to get better as we go more into the future. And that is all we have. So we thank you for your time. And if you have any questions, you can contact Kathy or myself. We have our email address right there.